It's been unprecedented, and it's not just a national trend either. Healthcare providers in Mobile say that they're seeing more children with severe cases of COVID-19. Some even need to go on a ventilator.
Now, Fox 10 News investigative reporter Brendan Kirby has been digging into this troubling trend, and he joins us live with more on this. And Brendan, we certainly didn't see nearly as many cases of kids with COVID last year.
No, we didn't, Byron and Lenise. So far, kids haven't been dying, but health officials say they're worried. For most of the coronavirus pandemic, the disease claimed older people while hardly touching kids. But children haven't escaped the Delta variant. Natalie Fox is the assistant administrator at the University of South Alabama Health System's physician group. She says there were 6 kids at Children's and Women's Hospital on ventilators yesterday. Today, the number was 5 out of 13 pediatric COVID patients in the hospital.
It's just unprecedented for us. We have not had that many pediatric patients previously affected that required this level of inpatient care.
COVID deaths are still rare for kids. In Mobile County, just 3 people younger than 18 have died of COVID since the pandemic started, and none in the last 14 days. But more children are turning up in pediatric intensive care units than ever before. Dr. Randy Murphy, the Mobile County Health Department's top epidemiologist, says this is coinciding with a delayed reaction surge in respiratory viruses.
So it is shocking to see so many children in PICUs and ICUs. And what we also did not have last winter is a typical flu season. And this summer, when masks came off, we saw a resurgence, a summertime spike in RSV infections in kids.
Healthcare providers are tracking more severe COVID cases in children across the country. But like adults, children have been hit harder in Mobile than any place else in Alabama. State Hospital Association President Dr. Don Williamson says there are 33 children statewide currently hospitalized with COVID, up from an average of 10 to 12 during the previous peak in January.
That does seem to be very different than what we saw earlier in the pandemic. I am extraordinarily worried about that, just based on what we're seeing in other places.
Dr. David Kimberlin is director of the Division of Pediatric Infectious Diseases at the University of Alabama at Birmingham. He says it isn't clear if the Delta variant is more dangerous for kids, but he says there's no doubt it's more contagious, and that's playing a big role.
This is the real deal, and I'm not real sure that folks in Alabama appreciate just how bad it is right now, and the fact that as bad as it is now, it's going to be even worse a week from now and 2 weeks from now.
Health officials tell me that these child cases aren't clustered at any particular age. They say that infants appear to be most vulnerable, but kids of all ages have been hospitalized. Reporting live, Brendan Kirby, Fox 10 News.